Welcome back to Health Every Day, everybody. And today we're going to be talking about probably the top 5 most common conditions I see in a week. Sciatica, something that many people experience on a daily basis, and there really just isn't any need for it. So let's just jump right into it. So I pulled this definition off of Wikipedia, but it'll do. So sciatica is a medical condition characterized by pain going down the leg from the lower back. And I just included, these are kind of my own personal experiences, but I don't know the true statistics, but it'll give you kind of a rough idea. So most people, like maybe 9 out of 10 times, have pain going down from the lower back into the glutes, hamstrings, calf to foot. So it's kind of like a straight line down the back or posterior side of your leg. And then like maybe 7% or so get it down the side. 3, it kind of like comes from the back kind of and then wraps around into the kind of like front of your hip, down the front of your leg. And then I just, as an anecdote, a lot of times when people are getting treated, you'll have all 3 of these symptoms will kind of appear, and then they'll go away after several treatments. This is a pretty good slide, kind of gives you an idea. So this is kind of the more rare, where you're kind of getting the side pain wrapping around into the front of the leg. And occasionally, I think I've had maybe 1 or 2 people, it actually goes down as far as the calf. But mainly this is the one that people talk about. So in the back, coming down into the glutes, kind of like a straight line through the hamstrings, into the calf, going down into the foot. Okay, so I wanted to go over some terminology because people throw around words all the time. So, and there's 2 or 3 different conditions, 2 or 3 different kind of ways of saying the same thing, but they're not necessarily the same thing. So sciatica is a nerve irritation, maybe some compression, usually from an injury, such as like a disc herniation or stenosis, which is like a narrowing of the spine, like the canals where the nerves come out. And then occasionally, like, there's physical changes. So potentially if you have like extreme scoliosis or have been in like a car accident or something, and maybe the spine needs to be fused together, but then there's like some sort of blockage, you might have this kind of like continuous nerve irritation, which causes nerve pain down the leg, which is sciatica. So that's kind of like what we call true sciatica. And you can definitely get a lot of relief from that with manual therapy. And there are a lot of people who it just totally goes away. So, but there's this other condition, which is the majority of people. So when we were just kind of talking about the other slide, so kind of 9 times out of 10. So most people have this kind of pseudo-sciatica, or a more popular thing now that people are calling it is piriformis syndrome. So, which is just a lot of times when people have nerve pain, whether it's in the hands, shoulder, like calves, feet, whatever, it's just a muscular compression. There isn't really anything else going on. And so this is exactly the same thing. So because of a lot of like sitting and different activities that we do, maybe you work out of the gym and you're doing lots of squats and things like that, but not a lot of like self-care. You're not stretching a whole bunch, and maybe your muscles are getting tight. So there's a lot of different things, but that can cause like contributing factors. But if you're not addressing that, you'll get what's called pseudosciatica or piriformis syndrome, which is now the kind of more common phrase that we use. So it's just a muscular compression over the nerve, causing irritation. So your glute muscles and are sitting over top of this muscle called piriformis. And actually, if we go back to, it's not a great picture. That piriformis is like, it's coming from underneath your sacrum, and it comes across onto what's called the greater trochanter. It just kind of like the head of your thigh bone right here. So it comes across, and then the nerve is coming through here. So if that muscle gets tight, you're going to get the compression, and you're going to feel that pain down the leg. So that's the difference. So, and that's why it's kind of called pseudosciatica, because sciatica is like an actual injury kind of related nerve compression, whereas this is more just the muscles are really tight or something along those lines with the muscles involved, and it's causing the irritation. Both can be treated. True sciatica is kind of patient specific. So depending on the state that you're in, it might take longer to treat, but a lot of people have a lot of relief with manual therapy. So whether that be through registered massage therapy, chiropractic, physio, acupuncture, some of the within the physio scope and chiropractic, there's like different things like shockwave and ultrasound that you can use, even dry needling, that can help with that. But the bottom line is the majority of people have piriformis syndrome, and it's always treatable. So that's a really, really good thing to note. Okay, so we've already kind of talked about this. So treatment options. So all manual therapy is good for piriformis syndrome because it's a muscular-related condition. So really it just comes down to preference. So a lot of people just like going for massage. Some people love physio because they're kind of really interested in like what is the dysfunction, what's happening, and that keeps them accountable. And then so many people, like literally most of my patients that have sciatica, they go see chiropractic. So much relief there. And that's more just to do with the fact that if you're consistent, so like people that really love physio, they're really consistent with their workouts and things like that. So they like to know what's happening with that. A lot of times chiropractic, people, when they go for their adjustments, they like to know that they're realigned, and then that actually promotes them to be more active. So it just kind of depends on how you want to go about it, but it's really up to you. So all of these therapies would work no problem. Like we were talking about before. So there's other things within the scope of practice through physiotherapy and chiropractic, like shockwave, ultrasound, potentially even some laser light therapies, acupuncture, right? So they're all really good. And that it gets you back into your kind of normal mode, gets you back into the living, and kind of like more movement and things like that will actually help relieve pain. So really it's always just about getting you back into your normal routine, which in turn will actually help with the pain to begin with, which is, I find, the most empowering thing that we can do. So home care, self-care, the problem with that is like, because I can't see you in person, it's kind of hard to say, but these are kind of rules to live by. So it's a lot of just self-care. So checking in with yourself, like what makes it worse? What makes it feel better? Oftentimes if it's just a muscular thing, heat will always be a good idea. And cold may not be the best idea, because cold sometimes will kind of cramp up the muscle, like make it feel even tighter. But some people say it works. So it's really just to each its own, but usually heat is better for muscular compressions and muscle tightness. So putting heat on the glutes, putting heat on the hamstrings and stuff can be relieving. What's your activity level? So yeah, like I just kind of alluded to that a second ago. So if you potentially are not as active as you usually are, so there's been a change in activity level, that actually can affect your pain level. So people, maybe not linking it together. So this happens quite a lot with sudden injuries. So like, let's say like you've been in a motor vehicle accident, something else precipitating some sort of injury. The inactivity actually will increase your level of pain. So it's one of those things people always ask me, like, why is my physio, they're always kind of like pushing me to just get back into activities, go walking, do things. And it's because we know that just we have a lot of receptors on our skin, on our muscle, just throughout the body, and our body is wanting us to move. So when you're not moving, sometimes there's kind of a miscommunication, and they will send more receptors, or there will be more attention to the areas of pain. And so you will perceive more pain. And so when you're moving and being active, a lot of times those pain receptors will actually become deactivated. to a certain degree. So you'll actually notice that the more that you work out, the more that, you're walking, you'll be playing with your kids, playing with your dogs, things like that, the pain levels will actually go down. So activity level, super, super important, and consistency. So the consistency of your routine throughout your daily life, super, super important. Let's say, and so like cool down routine. So yeah, do you find that like, at the end of your workouts, are you being consistent with how you cool down your body? So are you doing stretching? Are you foam rolling? Are you doing other things potentially? Like, are you going for maybe a sauna after you work out? There's all these different ways that people kind of do their post-workout as a routine to kind of keep them in this, healthy space. And if you're kind of a person who just works out and then goes home, no stretching, no cool down period, that might be a contributing factor to maybe a excess amount of tightness, or not necessarily tightness, but just it might contribute to you feeling like there might be an increase in pain post-workout. Something along those lines. The last one that I always kind of check in, this is actually quite a frequent one, particularly with neck-related issues. So if you got any kind of like headaches and things like that, and you feel like maybe your energy level is maybe a little bit inconsistent throughout the day, I see a lot of like desk workers. This is a big one. Hydration, electrolytes, super, super important. So just making sure that you're getting your somewhere between like 2 to 3 liters of water a day. Unfortunately, because of the scope of practice, because I'm a registered massage therapist in British Columbia, so electrolytes and like supplementation is kind of off limits. But usually what I just tell my patients is that if you can maybe, when you're eating your meals, potentially like maybe 15, 20 minutes beforehand, drink some water, because the hydration is super, super important. And I find that people who they do hydrate, they're saying, oh yeah, I'm drinking water all the time. Well, they say, oh, I have to go to the washroom all the time because I'm drinking all this water. Well, potentially drinking the water maybe 15, 20 minutes before you eat, there's minerals, there's vitamins, there's different nutrients in the food that you're eating that will kind of offset the kind of having to pee all the time, because your food will actually slow down the kind of absorption of the water, and then there's minerals in there that will hopefully help you keep the water a little bit longer so you don't have to keep peeing. Last but not least here, so knowing when you need to come in. So a lot of people who have been doing manual therapy for years, they just know when it's time to come in. But a lot of people don't. So just kind of checking in with yourself, if, a lot of times we just say, hey, for maintenance, maybe every 4 to 6 weeks. But if you're noticing like something's coming up and, waiting it out isn't helping you, because a lot of times, you might have pain one day and then there's no pain the next day. So there's no real reason to come in. So oftentimes waiting it out is fine. Your body is kind of like a self-resolving machine. But if you're noticing it's not working for you, just waiting it out, super, super important to come in. And then, yeah, if you've done manual therapy in the past, you kind of just know when it's time to come in. So that's like what I mean by self-care, just kind of checking in with yourself. This is a really big one, and I left it for last. So if you're finding that this is kind of not really to do with sciatica at all, but if it's just any condition that you're having, if you're noticing that things are not recovering, you're not getting a relief, kind of maybe even moods are changing, you might want to check in with yourself and wonder, why is that happening? Is there bigger reasons why things are staying the way they are? This happens quite a lot with WCB cases and motor vehicle accidents through ICBC. So it's not necessarily, no one should feel bad about that. It's just maybe checking in with yourself. And if there are any fears that you're having, make that known to the therapist, because a lot of times they can alleviate a lot of that. because no one really wants to go back to work too fast, right? You know, there's always a fear like, oh, I'm not going to be able to do my job, or I'm not going to be able to provide for my family. When you do things properly and you're open with your therapist, a lot of times those fears can be relieved. So that's what I mean by like, are there bigger reasons going on here than just one thing or another? So I think that's enough on that. Bottom line, sciatica is treatable. So I wanted to put this video out there because this is a super, super important topic for me. There's so many people that I've seen that are in maybe 50s, 60s, even 70s, and they've never gone for manual therapy. And, I can't guarantee a time frame, but I have had significant reductions for a lot of people with their pain within maybe 4 to 6 treatments. So, and that's not saying that, I'm special or anything, but when you have someone who knows how to treat something, it can feel like a miracle, or it can feel like it's amazing for the person, the patient, because they didn't know that something was possible. So this video is just really just to enlighten people that sciatica is definitely a treatable condition, whether it's true sciatica, pseudo sciatica, or piriformis syndrome, however you want to say it. But this doesn't have to be something that you have to live with on a daily basis. And I would like you to get some treatment today. All right, thank you for joining me. And if you have any questions or concerns, definitely drop a comment below. And if you have another topic, that would be great. I really would like some of these videos to be kind of sparked by comments, because that way I know where to go with the next video. If not, I think I'll just look for another topic that I feel you would like to listen to. And I'll see you next time. All right, have a good day. Bye-bye.